Right. Let's get some insight right now from Clay Johnson. He's the CEO of a firm called the Department of Better Technology. He's a former member of the Obama technology team. Clay, thanks very much for coming in.
It's great to be here. Thanks for having me.
This contractor says one of the problems was a late decision to force people to actually register, put all sorts of information in before they could go around and do some shopping, window shopping, as it's called, for possible programs, possible packages, and that last-minute change caused this blunder, in effect, to happen. What do you make of that?
Well, I think it's yet again evidence that the Department of Health and Human Services picked the wrong set of vendors to work on a project like this. I think any small business that's done professional services and technology is used to having clients that make last-minute decisions and develop technology that works around that. I think that CGI Federal really should have been able to handle that. When we have these debates over, how many lines of code are inside of Healthcare.gov, I mean, it's crazy because that's indicative of they're even measuring the wrong thing. Software that's written well should have less lines of code in it than software that's written poorly, which has lots of lines of code in it.
You wrote this the other day: Healthcare.gov got this way not because of incompetence or sloppiness of an individual vendor, but because of a deeply ingrained and malignant cancer that's eating away at the federal government's ability to provide effective online services. Explain what you mean by a malignant cancer.
Well, the way that government buys technology, otherwise known as procurement, is profoundly broken. What it does is it guarantees that the work goes to the people who have the best attorneys, not the people who have the best programmers. And I think if the Republicans in Congress were at the least bit interested in fiscal responsibility, they'd be worried about the billions of dollars that we spend going to large contractors to provide this subpar work. 96% of IT projects in the federal government fail if they're greater than $10 million. That seems to me like a place to look for prudent fiscal responsibility.
Can the current website be fixed, or should they just throw it away and start from scratch?
I sure hope so. I mean, I got a letter from...
You sure hope what? You hope what?
I sure hope it can be fixed. I got a letter from Aetna just yesterday saying that my health insurance rates were going down by $300 a month because of the Affordable Care Act, and I sure would like to shop around on it. I think it can be fixed. It's just going to take some time. But they've already, I think, made some good motions. They've brought in some presidential innovation fellows. I was a former presidential innovation fellow last year. Those guys know what they're doing, and I have a lot of confidence that they'll be able to really shape this thing up.
The White House released a video today of what are called real people explaining their experiences with the website. Let me play a little clip.
Have patience with the system. Take your time.
Don't worry, you will get in. It's really easy.
It told me to clear my browsing history, clear my cache, and clear my cookies, whatever those were. Gave me the instructions on how to do it, and once I did that, I went back onto the computer, and it sailed right straight through, no problems at all.
Now, those states that have their own websites, they seem to be doing a lot better than the national system, if you will. Why is there this difference?
Well, because of scale. You have 34 states that are not participating, that didn't build their own exchange. So that means the federal government had to build an exchange for 34 states. That's a lot bigger of a number than what was, I think, originally anticipated when the Affordable Care Act passed and when the dollars appropriated for this website were assigned. And so I think what happened is there are a lot more people that are using this website than were originally intended. Now, do I think that, if people clear the cache on their browsers, then all the bugs in the website will go away? No, I think the contractors here did a sloppy job. I think every time they try to defend themselves, they come up with another excuse that actually provides more evidence that they don't actually understand what it is that they're doing. And, I would like to see them replaced with people who know what they're doing, who can work at a fraction of the cost. If you look at Healthcare.gov, the front page and all that stuff before Apply Now, before you click on that button that says Apply Now, that all works fine. But that wasn't built by the contractors who built the sort of exchange part of the website, which is really too bad.
Too bad indeed. Clay Johnson, thanks very much.
It was great to be here. Thanks, Wolf.